Blue Cross Idaho is driven to make healthcare more affordable. And we're doing a few things to do that. We are leveraging data in a different way than we ever have before to make very smart, innovative decisions on how to drive increases in quality and decrease the cost of healthcare. We're putting the doctors in the middle. We are delivering data to them so they can make the decisions to ensure that our members, their patients, our families, our friends, our neighbors receive high quality care that's efficient and affordable. So they now have more insight into the quality care they're delivering, the efficiency of the care. We're delivering that data to them so they can make those decisions. And through IBM Watson's product, that completely enables us to do that. What drove us to do this and why did we feel like we needed to use data in a different way? It's because of an intense passion to deliver more affordable care to the people of Idaho. Idaho is an absolutely fantastic incubator for healthcare innovation. Why is that? Number one is you have a payer, Blue Cross of Idaho, that is obsessively focused on Idahoans. The second reason why Idaho is such a great incubator for innovation is the provider community. We have providers here that have that same passion and commitment to affordability and high quality care. We've talked to a lot of people nationally, and nationally they've provided the insight to us of not a lot of people are doing this nationally, that you guys are actually using data, data that's proven, it's not subjective, to help members get to higher quality, more efficient care, which leads to better outcomes, better results, and it's more affordable care.
I've been a neurosurgeon for a long period of time, and I've always been interested in outcomes. Most of us are, we're scientists, and we look at lots of outcomes that we can find. In the past, the main important things were low complications and high quality, and the cost really didn't matter so much, or it was so uncontrollable that nobody really talked of it in a big way. The billing and collecting at those hospitals is so complex that they couldn't tell me how much a surgery actually cost. They couldn't tell me how I can improve cost because they didn't know. I was so proud of how frugal I must be that when Blue Cross told me that they were going to do this neat new thing to analyze costs, I was actually very excited about it. I thought, great, someone's finally going to see all the work I've done, and I'm going to shine finally and you know, just blow them all out of the water. I was very excited about it. Well, it couldn't have been further from the truth. I was the most expensive guy in the entire Northwest. Obviously, I was very upset by that. The Blue Cross people made it very clear to me. It's not you. You have zero complications. We're thrilled with all that. And it's not anything that you can control. It's one thing and one thing only. It's the hospital that you're operating in. I said, well, okay, who's less expensive? Because I don't want to take my patients to a low quality place just to save money. I'm about the patient. But if I can do great quality and save money, well, it's a win-win for society. So it only changed by me looking for a more efficient, less expensive place. So that was the big thing. And once I found that, it became very simple. And so I flipped every Blue Cross patient that I have for the last 3 years has gone to that hospital, the high quality, lower expense hospital. Patients are much happier. Their ratings are, the hospital ratings are fantastic. Zero complications. Patients love it. They rate it very highly. We all need to be willing to change for the better, and part of that is cost. If you can maintain your quality and low complications and good outcomes, and you can do it for half the cost, why wouldn't you?
There was a real hunger for this kind of data, because they just didn't have a good point to access that type of information. Prior to this kind of data being readily available for them, that was not part of their decision making. They just referred to where they knew the quality was, but their assumption was that there was not a differential in cost, and we were able to teach them that that is not always the case. Our providers are not sacrificing quality, moving their patients to other options. Providers high quality in Idaho exists everywhere. This data has just armed them with information of choice so that they can have more transparency in what's available for the members for referrals. We absolutely are seeing real-world results from this data. The largest portion, service portion, is our orthopedic care. And we actually have seen over a 3% decline in costs in the orthopedic because of the choice factor. I also think that just the overall view of more is better is really changing. It speaks to our commitment to our members, that we understand the challenges that folks face in our state and in our community. And as the providers become more educated and the members also become more educated with our member tools, then I think we're going to have a positive impact for the cost of care.